Plague, aka also known as the Black Death. It is the largest pandemic of the world and which has occurred in the 14th century, mainly in Europe, Asia and Northern Africa. Killed over 50 million lives, that is 5 crore people, caused by Yersinia pestis, a biotype Antiqua, Antiqua. So here you can see a clinical picture of a Black Death. Why it is called as Black Death? Okay. So coming to the topic, what is plague? Plague, it is one of the bacterial infection which is caused by Yersinia pestis. Okay, and Yersinia pestis is a zoonotic disease. Yersinia pestis, Yersinia pseudotuberculosis, and Yersinia enterocolitica are the three forms of Yersinia. The word Yersinia came from the scientist named Yersin, who discovered Yersinia pestis in the Hong Kong. What is the transmission? First, this Yersinia pestis is present in the rat. Then rat flea sucks the blood of the rat and it also get infected, and it also infects the humans. This Yersinia pseudotuberculosis and Yersinia enterocolitica causes the GI illness. And vector is a rat flea that is also known as Xenopsella chiopis, which infects the humans. Mode of transmission is by bite of the infected rat flea, direct contact with the tissues of an infected animal, droplet inhalation from man to man in a pneumonic plague. Next is blocked flea. What is blocked flea? In the gut of the flea, bacilli multiply enormously and may block the proventriculars. So first a rat is there, and a rat contains a large number of bacilli, and rat flea which is present on the rat. This rat flea sucks the blood, that is 0.5 ml of the blood. 0.5 ml of the blood which contain 5000 bacilli, and these bacilli is a large amount of bacilli which is present in the gut of the rat flea, and it blocks the GI of the rat flea. Thus, while making an effort for sucking the blood, the rat flea transmit the infection. Next, as the GIT of the rat flea is blocked, the rat flea dies. Next is virulence factor. Virulence factor is a F1 fraction 1 antigen which inhibits the phagocytosis by macrophages. This F1 antigen is the virulence factor which causes the disease, and it is also a immunodiagnostic marker of the infection. There are other virulence factors such as phospholipase D, serine protease, lipopolysaccharides, pigments, adhesions which helps in attachment, and next is siderophore which traps the iron. Next, what are the human plague is caused by three types, that is bubonic plague, pneumonic plague and septicemic plague. Three types: bubonic plague, pneumonic plague and septicemic plague. Next, coming to the bubonic plague. What is bubonic plague? Bubonic plague is transmitted by the bite of the infected rat flea. And first the bacilli goes to the local lymphatics, then goes to the regional lymph node, multiply there, and if untreated they disseminate to the other organs. And incubation period is of 2 to 7 days. Features: fever, malaise, headache, painful lymphadenitis. Lymph nodes are enlarged in the bubonic plague. Thus, most probably the inguinal group of lymph nodes, then axillary group of lymph nodes. So when palpation, you can see enlarged lymph nodes. Fever, malaise is common. Now, what is buboes? Buboes are the regional lymph nodes which appear tense and tender swelling. As the lymph nodes are enlarged, the bacillary load increases in the lymph nodes, and you can palpate them easily. The bacilli are locked inside the lymph nodes and cannot transfer from person to the person. In bubonic plague, the bacilli which are present inside the lymph node cannot transmit the plague. Next, coming to the pneumonic plague. Pneumonic plague, here word pneumonic itself indicates it affects the lungs. Transmitted by the inhalation of the bacilli in the droplets expelled from the another already infected person. Incubation period is of 1 to 3 days, and features are fever, headache and respiratory symptoms. This pneumonic plague is highly infectious and highly fatal and an agent of bioterrorism. Next, coming to the septicemic plague. Septicemic plague develops from the spread of bubonic and pneumonic plague, and here the incubation period is of 2 to 7 days. This septicemic plague is very rare and spread by the accidental laboratory infections. Okay, septicemic plague is very much rare. Here there is massive involvement of the blood vessel, leads to the hemorrhages in the skin and mucosa, gangrene of the affected site, black death. Next, There are three types: bubonic, mnemonic, and septicemic. Now coming to the laboratory diagnosis. So first you should understand how the laboratory diagnosis is written. First there is specimen collection. After collecting the specimen, we will transport it. So we use a transport media. Then we will do the direct microscopy of the specimen. That is staining. And next we will do the culture. In culture, we see the motility. We will do cultural smear and how the which type of growth. Next, identification. Identification is by automated methods and a biochemical test like catalase, oxidase, and ICUT. Next, we will do the antigen detection and antibody detection. And at last, we will do molecular methods. And one more thing, that is antimicrobial susceptibility testing if the organism is antimicrobial resistance. Okay. So coming with the laboratory diagnosis, it is like fill in the blanks. We have to fill the what all things we are going to do in plague. That is to identify Yersinia pestis. What first specimen collection? Bubonic plague, we collect pus, fluid aspirate from the buboes. In pneumonic plague, we collect the sputum and blood. In septicemic plague, we collect the blood and the splenic aspirate. Now coming to the transport media. Transport media is Clary-Blair medium, where we also heard this Clary-Blair medium in Vibrio cholerae. And while doing this, we maintain biosafety level 3 must be maintained. So at Aziza12345 is my Instagram and Telegram handle. You can message me there, and at medicomemes12345 is the Instagram meme page. So we share their educational content and the fun memes. You can join them. Now coming to the direct microscopy. Direct microscopy is by gram staining. Here the pus cells are gram-negative cocobacilli with rounded ends and surrounded by a capsule. Capsulated is there and it is gram-negative, which shows pink color on gram staining. Pus cells are there. Next, now is Wason stain, bacilli with typical bipolar safety pin appearance. Safety pin appearance means Yersinia pestis, and which is seen on Wason stain, okay, not gram stain. Culture. Culture is by blood agar and a McConkey agar. On blood agar, we see non-hemolytic dark brown color pigmented colonies. On McConkey agar, we see non-lactose fermenting colonies, which are colorless. If it was lactose fermenting, it will be pink color, okay. On blood agar, it is non-hemolytic and non-lactose fermenting. Non-hemolytic, non-lactose fermenting. Now, cultural smear and motility, it is pleomorphism. Pleomorphism means variable number of shapes is seen, and it is non-motile. Identification is by Malditoff. And biochemical test, we see catalase positive, and remaining all are negative. You can see like oxidase is negative, ICUT is indole, citrate, urease, and triple sugar iron test. All are negative, and no H2S is also seen. Now coming to the antigen detection, you know that virulence factor is a F1 antigen detection. Virulence factor F1 antigen, do you remember? F1 antigen from the bubo aspirate of this or sputum. We do direct immunofluorescence assay, enzyme linked immunosorbent assay, and immunochromatography test. Next is antibody detection. Antibody detection is by antibodies against this F1 antigen are produced. Those antibodies are detected. Okay. Next, coming to the molecular method. Molecular method is polymerase chain reaction. So in molecular method, we will find a gene which codes for this F1 antigen. Now, prevention is better than a cure. Prevention of plague is by controlling the cases or controlling the fleas or killing the rodents. Cases, we can control the cases by early diagnosis, isolation, and treatment. And fleas can be killed by dichlorodephanyl trichloroethane, that is DDT, and BHC, which is an insecticide. Chemoprophylaxis. Vaccine is available for this plague. That vaccine is live attenuated vaccine. The strain used is EV76, which is given subcutaneously 2 doses 4 weeks apart. Booster after 6 months. Short lasting protection. Another one vaccine is formalin killed, that is Suke's modification of original Hafine vaccine. Vaccine only for prevention of anticipated outbreak. So here is a picture from the Apurva Shankar Shastri textbook. So you can see there is a black death and a plague manifestation. There is an enlarged lymph nodes. That is here the plague swollen inguinal lymph node is seen on the left side, and gangrene of the toe, which turns a Dej disease, black death, as blood supply to there is cut off and there is black death. Gangrene, you remember gas gangrene. There are totally 3 types of gangrene: dry gangrene, wet gangrene, and gas gangrene. So here you can see almost it is like dry gangrene. Now it is a Wason staining. Wason staining which demonstrate bipolar appearance of the Yersinia. So you can see safety pin appearance, like safety pin. You remember this safety pin here, this like safety pin appearance. It is like safety pin appearance, and this is Wason staining. As it is looking little purple color, don't say it is like gram positive. It is a gram negative on gram staining. In Wesen staining, it shows safety pin appearance. In safety pins, it means the end, both the ends are highly stained and with central halo. Now coming to the treatment of this Yersinia pestis, streptomycin is the drug of choice earlier in the past for which was given for 10 days. But now the drug of choice is gentamicin, which is recommended for treatment. For post-exposure prophylaxis, we will give levofloxacin. Alternate drugs such as doxycycline and chlorofenolone are also effective. Beta-lactams and macrolides are generally not recommended as they poor in response. Now guys, as we are also giving a revision to this plague, so you should subscribe. You must subscribe to my channel. Now coming to the revision, laboratory diagnosis. Specimen collection in bubonic plague, we give lymph node aspirate and the pus. In pneumonic plague, we give sputum and the blood. In septicemic plague, blood, splenic aspirate and post-mortem. Transport medium is clary-blade and biosafety level 3 is maintained. It is a gram-negative coccobacilli with rounded ends and with central halo, and pus cells are also seen. And Wesen staining, bipolar safety pin appearance is seen. Culture, aerobic and facultative anaerobic. On blood agar, it is non-hemolytic. Dark brown color colonies are found due to the pigment, and on McConkey agar, non-lactose fermenting pale color colonies. And cultural smear, it is pleomorphic and non-motile. Okay, motility, Yersinia pestis is non-motile at 25 degrees Celsius to 37 degrees Celsius, and Yersinia other species are motile at 25 degrees Celsius and non-motile at 37 degrees Celsius. It is one extra point. So you better read by yourself once. Set these things in the mind. Continuation. Identification, we give the biochemical test. One thing is catalase positive, remaining all are negative. Oxidase negative, ICUT negative. Automated method, Malditoff and Vitek. Remember, automated methods are Malditoff and Vitek. Antigen detection, we will detect F1 antigen sputum by sputum and buboaspirate, and we will verify by antigen detection by immunochromatography test, enzyme linked immunosorbent assay, and direct immunofluorescence assay. Antibodies to that F1 antigen can also be detected by ELISA and passive agglutination test. Molecular by PCR, we will detect the gene. So guys, here we come to an end. Yersinia pestis is done, which is a zoonotic infection and which caused the death of 5 crore people. So see you in the next video. Until then, Jai Hind, Jai Bharat.